Let's go across to our doctors who are joining us this morning to make a sense of what the COVID situation in the country is. We're joined by Dr. Vivek Nangia, Principal Director and Head Respiratory Critical Care Medicine at Max Saket. Also, Dr. P. Raghuram, President Association of Surgeons of India. Dr. Nangia, first to you. Every day we're seeing the numbers go up by over 50,000. However, in Delhi, the cases have come down and many believe that Delhi has crossed that peak.
Yeah, it seems so actually, Gargi. I agree with you that the numbers in Delhi have actually come down. Even in our hospital now, we don't see as many patients from Delhi per se coming to us, but they're basically people from the neighboring cities and states that are coming to us now. We're getting more of the patients from UP, especially cities like Meerut, Lucknow, Kanpur, Gorakhpur, Jhansi. So these are the places where we are getting most of our patients from. And even if we see and whatever cases that we're getting, mostly are milder now in the illness. So that is also a change that is happening. We're getting more of mild patients now.
That's very interesting. Why do you think that is?
That is either probably because of the herd immunity that people are developing, from their neighbors, from their friends who might have been asymptomatic carriers. So one is that. And second is that possibly because people are now coming early in the onset of disease, where interventions can be started early. Even for COVID, it is said, the earlier you start with the appropriate treatment, the better it is.
All right.
The more you delay, then more the complications set in, and most of these complications can be irreversible at times.
All right,
so those are the two reasons I feel.
So that's good. That means people are also more aware of what to watch out for and when to seek that intervention. Dr. Raghuram, however, in the south, we're seeing the cases are really increasing and also stress on hospitals.
Yes, the number of cases are increasing and it is a worrying trend. If you look at India as a whole, we are the third largest in terms of, the numbers and also the fifth in terms of the worst affected country. Basically, we must understand that India is a huge country. We have a population of 1.38 billion compared to the United States of over 300 million and Brazil over 200 million. So when you look at a population as a whole, the absolute number of cases being diagnosed is significant. And also the absolute number of deaths are also increasing.
Right.
But if you look at mortality per million, India stands at 28. And if you compare to any other Western country, it's about 600. So it's 20 times higher. And even the case fatality rate in India, which is 2%, which is, if you compare it to any other country in the West, it's over 15%. So even if you consider India is, there's no possibility of hiding numbers, although there is a perspective. Even if you consider that the numbers are 2 or 3 times more, still we are in 2 digits compared to anywhere else in the world. So these are all good pointers. And also the number of patients who are recovering is 67%, which is very, very reassuring.
Right. The doctor, as many have pointed out, and the WHO also says that at least 99% are expected to recover. So that's one of the, what experts say, that 99% are expected to recover, even though in India we do keep talking about the recovery rate.
Yes, and also we must realize that, the number of patients requiring oxygen support is about 2%, around 2%, and those requiring ICU care is even lower at 0.22. That is about 1 in 500 require ICU care, ventilator support. So it's certainly, these are all reassuring trends. The numbers will be high, and I don't think we should be very alarmed with just absolute numbers.
All right. And Dr. Nangia, now if we again talk about Delhi, since, now a lot of the patients, we've seen the big, surge at the beginning and a lot of the patients have recovered. What are your observations now? Are people coming back with any problems, those who've recovered with coronavirus? Because now we're getting reports that people are, experiencing a scarring of the lungs, and that's something that's very concerning.
Yeah, Gargi, you're absolutely right. So there are now what we're dealing with is the post-COVID sequelae also, which we were not seeing till about a month and a half back. Now, there are lots of patients. The most common symptom that they're developing in the post-COVID times is extreme exhaustion, fatigue, exhaustion. And then is breathlessness. Then is a new onset fever that they're developing after 3 or 4 weeks of their illness, when they had recovered initially, had gone back home from the hospitals, or even when they were milder in onset. But the severe cases are coming back with pulmonary fibrosis as well, where they're developing, where they're experiencing breathlessness. And when you get their CT scans done, it shows scarring in the lungs. And this scarring, to some extent, could be irreversible also. We still don't know how it will pan out in the next month or two. But yes, these are the most common complications that people are coming back to us with. And then, of course, people are also coming back with certain kinds of rashes, some lesions in the skin, and then what is called the COVID toe. Those are also things that we are seeing these days.
All right, so that is something that is very concerning, and really even as Delhi has crossed that peak, it's no time to relax, because we've already seen in Europe the way you're having these second waves or resurgence of COVID infections. Dr. Ram, as you said, that we have to also look at the numbers, and the latest numbers coming in, if we talk about the deaths, is 900 deaths have been reported in the last 24 hours. So it's very concerning to see that the number of deaths is also increasing. In fact, 2 days ago, India was the one country in the world that had the highest number of deaths in a 24-hour period.
Yes, indeed, Gargi. This also reflects in terms of the number of tests that we are doing in the country. We are now doing over 6 lakh tests per day, and we are heading towards the 10 lakh tests per day. So therefore, the more number of tests that we do, more number of cases will be detected. But I think, as I said earlier, we must bear in mind in terms of the mortality, in terms of per million, and also the case fatality rate, and also the fact that 67% of our patients are recovering. So these are reassuring trends, and I think people are also getting unduly stressed with a lot of prominent people who are being infected, and obviously they are in the news. So there's a lot of concern and stress in the community. So I think people must be reassured that we're doing well, and we must, as a nation, concentrate pan-India on testing, tracing, tracking, and treating effectively.
Right, and interesting you point that out, since we had several leaders and chief ministers also testing positive for coronavirus. Yesterday, Shivraj Singh Chauhan was actually released from the hospital after recovering from COVID. So it's very necessary that the leaders also come out and be very candid about, the fact that they've tested positive, that they're seeking treatment. So this helps to do away with any sort of, anxiety, as you said, any sort of taboos around coronavirus.
Indeed.
All right, Dr. Nangia, if I could come to you regarding, the testing which Dr. Ram spoke about. WHO, however, has still said that India is testing lesser than other nations currently, and that's still a matter of concern, though, of course, we have ramped up testing. Also, there is that issue between the rapid antigen test, which is, increasingly being used in many areas, though it does turn up a lot of false negatives. And the Delhi High Court, in fact, pointed out that we should rely more on the gold standard RT-PCR test.
Yeah, absolutely. As far as diagnosis of COVID is concerned, you would need an RT-PCR test. Antigen is slightly unreliable. So what our policy is that we do one COVID antigen test. If it is positive, we consider the patient to be positive. But if it is negative, then one would do an RT-PCR. So antigen test serves more of a screening test and can be done because the advantage is that, one, it's cheaper. Second,
right,
the report is available to you within half an hour. So you know exactly what you need to do, at least in 50% of the cases. In the remaining 50%, if the clinical suspicion is high, then one would suspect them to subject them to the RT-PCR as well. So that is a policy that we are following.
All right, Dr. Raghuram, if we talk about, schools opening right now, we have no word on schools opening. We'll find out in the next phase of the unlock what the government decides. Gyms have opened from yesterday, in fact, in many parts of the country. But when it comes to schools, since it's been such a big debate abroad in the United States, in Europe as well, what are your views on reopening schools without a vaccine in place?
I think we should go slow on that. I think we should ensure that we have numbers. We flatten the curve, if not bend the curve, before we reopen schools. And certainly in terms of gyms, people should not go to gyms at the moment. That's advisable because we are in the midst of an ongoing raging pandemic reaching its peak. So the last thing we must do is to exercise in a public space. And particularly, I see a lot of people, in gyms exercising with their masks on. I see visuals. And I think that is something that should not be done because it reduces the airflow and, can cause serious problems. So I think we should go slow on this, in terms of the schools as well.
All right, Dr. Nangia,
Gyms especially, I feel.
Right, I know your view as well, that you're also very cautious about, people going back to the gyms, and if they just absolutely have to go back, they must exercise a lot of caution when they're at the gym.
Absolutely, that is very, very essential, because exercising in the open is still preferable. Exercising at home with virtual classes is still preferable than going into the gyms. Gyms are definitely going to be another source of cross infections happening because they possibly can't be maintaining all those standards that are required. One, of course, social distancing. Two, that the machines need to be sanitized after every customer has used it. And three, that they should be avoiding taking a shower there in the gyms only. Fourth, that there should be adequate ventilation there. Most of these gyms are centrally air conditioned. Some of them are running in the basements. They don't have adequate exhausts. So they need to have exhaust fans also along with air conditioning happening. And fifth recommendation that I would give to most of the viewers is that they should book their slots before they go. Rather than waiting there for the equipment to get free, rather than just hanging around, touching things here and there. It's always better to book your appointment in advance, and you know that the equipment will be reserved for you and you'll be able to use it there and then.
All right. Well, thank you both, doctors, for joining us on the show today and sharing your thoughts about coronavirus and exactly where we are right now, and nationally speaking, as the numbers are climbing every day, but still, it's not a cause. Right, Dr. Ram, do come in. Yeah.
If I may add one more point, I see a lot of people wearing their masks. They're not wearing it properly, and it's absolutely no use wearing a mask which is not effective. And I also see a lot of people who are very prominent, including many politicians, who lower their mask when they are giving an address. The whole point of wearing a mask is to protect your nose and your mouth and below the level of the chin. So if you move your mask to the level of the neck, all the germs in the neck will come back when you put the mask back. The whole point is when we are speaking, when we are making public address, we must wear a mask which is fitting properly. If it doesn't fit properly, then there's no point of wearing that mask.
All right, very important point that you're making there. And yes, this is something that has been remarked upon, how many politicians, though they have the mask, they wear it somewhere around their chin. And that, as you've said, is not very helpful. So we need to reiterate to everyone that do ensure that you wear your masks properly. It's very, very important, and it's useless if you don't. Well, thank you, doctors, for joining us today on the show.